So the challenges we face are very similar to those faced across the NHS. We have large numbers of patients in our acute hospital beds who we know, they know, their families know, the staff know that that acute bed is not the best place for them to be. So if through the use of technology we're able to intervene much more proactively before they ever get close to the acute hospital and help them manage their conditions closer to home, or if we're able to intervene much earlier during a hospital stay in a way which allows them to return home much more quickly, all the evidence says that that is much better for the patient. Very often in terms of our community services, we haven't had the right kind of technology available, and we haven't provided staff with the right kind of support that allows them to use that technology and really make the most of it. So where we've had some success recently has been, particularly with the community staff, really providing them with some of those tools which allow them to be really out there in people's homes, in the communities, really getting to know the patients and really being able to work in a much more agile and nimble way.
It's make a big change in district nursing, reality, it make a big change. Before mobile working, only a third of nurses' time was spent with the patients. The third was spent in administration, and the rest of their day was on traveling.
And before mobile working, I would have to go to the office, which would take 20 more minutes from my time. But since I'm mobile working, I'm able to open the device at home and check all of my patients, all of their care needs, and everything regarding their medical conditions.
When we check the last 6 months, we find that nurses' visits is increased by 2 visits a day per nurse. So by visiting more patients, we reduce the wait for A&E, and then we give the care and the right place and the right time for those patients.
For Lewisham, the purpose of Citrix is to deliver apps and data out to clinicians wherever they are. They can pick up a borrowed notebook, they can pick up a mobile device, and they can spend more time in front of the patient with the correct apps, the correct data, in order to make better clinical decisions. Citrix has long believed that work is a thing you do, not a place you go, and for the NHS and for the clinical staff, this is the beginning of that journey.
So from our perspective, it's really important that we're able to provide really modern, forward-thinking models of care and providing people with the tools to provide that care in the right way. So the ability to provide that flexibility in the way that they work is really, really important to us.